You jolt awake at 3 a.m. Your calf is locked up, burning with pain. You try not to scream, but you can't help it. It's the third time this week. If this sounds familiar, you're not alone. Nighttime leg cramps are incredibly common in older adults, and for many people over 60, they're not just annoying, they're terrifying. 1 second you're sleeping, and the next, you're frozen, helpless, sometimes gasping for breath from the sheer intensity of the pain. You've probably done everything they told you. You drink more water, you stretch before bed, you even take magnesium, because everyone says it helps. But if you're here, chances are it hasn't. In fact, the sentence I hear the most from my older patients is this: "Doctor, I take magnesium every night, and I still wake up screaming." I'm Dr. Thomas. I specialize in chronic pain and neuromuscular recovery, and in this video, I'm going to show you exactly why magnesium often fails and what works instead. You'll learn 3 real solutions. 1 you can use before bed, 1 you can use while the cramp is happening, and 1 that takes just 30 seconds and has stopped cramps for hundreds of my patients. These aren't gimmicks. They're simple, practical methods backed by research and real-world experience, designed specifically for seniors who are tired of suffering in silence. Because when it's 3 a.m. and your body turns against you, you don't need vague advice. You need relief. And you need it now. 1. Why magnesium often fails. Magnesium is often the first thing people turn to when they start experiencing leg cramps. And for good reason. It plays a key role in muscle function, nerve signaling, and preventing spasms. But here's the hard truth most people don't hear. Oral magnesium doesn't work for everyone. There are a few reasons why. First, magnesium absorption through the digestive system is unpredictable, especially as we age. Our gut becomes less efficient at absorbing nutrients, and many common medications further interfere with magnesium uptake. On top of that, oral magnesium pills tend to be large, hard to swallow, and can cause side effects like stomach upset or diarrhea. Some even report grogginess or fatigue after taking them regularly. More importantly, even when magnesium levels improve on paper, the cramps often return. That's why the most common thing I hear from my patients is, "Doctor, I've tried magnesium. I take it every night, but I still wake up in pain." In fact, a 2020 review by the Cochrane database, one of the most respected names in medical research, looked at 11 clinical trials and concluded that there is no strong evidence that magnesium supplements prevent leg cramps in older adults. That doesn't mean magnesium is useless, but it does mean that if you've tried it and it didn't help, you are not doing anything wrong. You just need a better way to deliver it, and that's where the next technique comes in. 2. The breakthrough. Topical magnesium oil. If magnesium pills don't work, or worse, leave you feeling bloated or drowsy, there's another option that many of my patients have found incredibly effective. Topical magnesium oil. Despite the name, it's not actually an oil. It's a concentrated solution of magnesium chloride and water that feels slightly slippery when applied to the skin. But here's why it matters. It's absorbed directly through the skin and into the muscle tissue, bypassing the digestive system altogether. This makes it especially useful for seniors whose digestion may not be as efficient as it once was. And because it acts locally, it often brings relief much faster than oral supplements. In fact, a small pilot study published in 2024 found that 5 out of 6 participants experienced noticeable relief from muscle cramps within 30 seconds of applying topical magnesium to the affected area. Here's how to use it. Spray 2 to 3 times directly onto the muscle that tends to cramp, commonly the calf or hamstring, then gently rub it in. If you're using it as a preventive step, apply it to the bottoms of your feet before bedtime. That area has high absorption and can calm overactive leg muscles while you sleep. Some users experience mild itching when they first start using it. Don't worry, this is often a sign of magnesium deficiency. With consistent use, the sensation usually fades within a few days. For my patients who suffer nightly cramps, this method has been a game changer. It's easy to apply, safe for most people, and doesn't involve swallowing anything. Plus, you can carry a bottle with you and use it at the first sign of tightness. If you've given up on magnesium, don't. You may have just needed the right delivery method. 3. Muscle scraping. Gua Sha technique. If you've ever had a cramp so deep it felt like your muscle turned into stone, this next method might surprise you. It comes from a traditional therapy called gua sha, or muscle scraping. And no, you don't need fancy tools to try it, just a regular kitchen spoon and a bit of massage oil. The concept is simple. By gently scraping the surface of your skin over the cramping area, you stimulate blood flow, reduce muscle tension, and break down soft tissue adhesions that may be contributing to the cramps. Recent studies support this. A 2025 review of randomized controlled trials found that gua sha can significantly reduce pain, decrease muscle stiffness, and improve mobility, especially in older adults. The key? Consistency and correct technique. Here's how to do it. Grab a metal spoon. The back handle works well, especially if it's smooth and rounded. Apply a lubricant. Coconut oil, massage lotion, or even olive oil works fine. Coat the area, usually the calf, hamstring, or inner thigh. Start scraping. Hold the spoon at a 30 to 45-degree angle and gently stroke upward toward the heart. Apply light but firm pressure. You don't want pain, just deep stimulation. Go slow. Cover one spot with about 5 strokes, then move slightly to the next. Continue until you've gone over the entire muscle. Repeat as needed. Spend extra time on spots that feel gritty like sandpaper. That's where the muscle fascia may be tight or inflamed. You may notice small red patches or tiny raised spots on the skin. That's normal. It means blood is moving into the tissue, bringing oxygen, removing waste, and helping the muscle recover. What makes this especially useful for leg cramps is that it not only relieves pain during a cramp, but also helps prevent future episodes by restoring muscle pliability and circulation. And unlike pills or even topical sprays, this method gives you full control. You can focus precisely where the pain is, adjust the pressure to your comfort, and do it at any time, even in the middle of the night. Thousands of seniors around the world are turning to this method because it works, it's free, and it's something you can do on your own. 4. The knee pump exercise. Sometimes the key to stopping a cramp isn't a supplement or a spray, it's movement. But not just any movement. You need the right kind of stretch that eases tension without making the pain worse. That's where the knee pump comes in. This simple technique has helped many of my patients stop a cramp in its tracks, especially when they catch it in the early stages, just as the muscle starts to tighten. It's safe, gentle, and can be done in your bedroom, right when you feel the cramp coming on. Here's how it works. Stand upright. If you're already out of bed, find a firm surface to steady yourself, like the wall or back of a chair. Get into a scissor stance. Step 1 foot forward, the other back. Keep both feet flat on the floor. Place your hands in a prayer position against your chest. This helps keep your spine straight and engages your core. Gently lunge forward. You should feel a stretch in the front of the hip and thigh of your back leg, especially if you've been cramping there. Now pump the back knee. Slowly straighten it, then slightly bend again, like a slow, controlled piston. Each pump should feel like you're releasing pressure. This pumping motion encourages blood flow through the entire kinetic chain. Hip, hamstring, knee, and calf. It loosens the muscle and trains the nerve pathways to release, not seize. Aim for 10 to 15 repetitions on each side. Don't rush. The goal is to move with control, not force. You may feel a burning sensation in the glute or hamstring. That's normal. It means those muscles are activating, helping stabilize the area and override the cramping response. Best of all, this exercise doesn't require any equipment, and it builds strength and balance over time, so you're not just stopping the cramp, but reducing the chances it returns. 5. Inner thigh lunge. Modification. Most people stretch the back of the leg when dealing with cramps, but one area that often gets overlooked, yet causes some of the worst pain, is the inner thigh, also known as the adductor muscles. Many of my older patients complain of deep cramps in the inner thigh that feel paralyzing. The solution? A gentle side lunge that targets exactly where the tension lives. Here's how to do it safely, even if your balance or flexibility isn't what it used to be. Stand tall, with feet slightly wider than shoulder width. Put your hands together in a prayer position at your chest. This helps keep your posture upright and prevents back strain. Step to the side. Shift your weight over to one leg, let's say the left, and bend that knee slightly. Keep the other leg straight. Your right foot stays flat. You should start feeling a stretch on the inside of your straight leg. The deeper you shift, the more you'll feel it, but don't push too far. Start slow, then build over time. Hold this stretch for 3 to 5 seconds, then return to center. Repeat on the other side. Aim for 10 to 15 repetitions per leg, slowly building range of motion. If balance is a concern, you can hold on to a chair or counter for support. You can even do a seated version by sitting on a sturdy chair and gently pressing your knees apart using your elbows. This movement not only targets a commonly ignored muscle group, it also improves hip mobility, helps with balance, and can reduce stiffness throughout the entire lower body. The inner thigh is a common source of nocturnal cramping, especially in women over 60. Including this stretch in your nightly routine may prevent cramps before they start and give you back the freedom to move without fear of seizing up. 6. Prevention habits and sleep setup. If leg cramps have been haunting your nights, the key isn't just reacting when they strike. It's creating an environment where they never start. Here are 4 simple habits that can make a big difference. 1. Apply magnesium oil before bed. As mentioned earlier, magnesium works best when applied consistently. Before sleep, spray a small amount on the bottoms of your feet. 2 to 3 sprays per foot is enough. This area absorbs magnesium well and can keep leg muscles calmer through the night. 2. Stay gently hydrated. Instead of drinking a large glass of water right before bed, which might wake you to use the bathroom, spread your hydration throughout the day. Sip small amounts often and aim for at least 6 to 8 cups daily. Dehydration is one of the most overlooked causes of nighttime cramps. 3. Don't elevate your legs too high. Propping your feet up with thick pillows may reduce circulation. Try to keep your legs gently level, with just a slight bend at the knees to avoid restricted blood flow. 4. Try a 5-minute bedtime routine. Simple, light movements like slow squats, ankle circles, or gentle standing lunges can prime your muscles for rest. Think of it like brushing your teeth, but for your legs. It signals to your body that the work is done and it's time to recover. These habits are small, but when done consistently, they retrain your nervous system, support blood flow, and help prevent the sudden snap of a 3 a.m. cramp, because a peaceful night's sleep starts long before your head hits the pillow. If you've made it this far, one thing is clear. You're not just hoping the pain will go away, you're actively looking for answers. And that makes all the difference. Nighttime leg cramps don't just rob you of sleep, they steal your energy, your confidence, your peace of mind. I've met countless patients, strong, resilient people, who've said the same thing. I'm not afraid of getting older. I'm afraid of waking up in pain every night. But now, you're equipped with more than hope. You have tools. You've learned why magnesium pills often fall short and how a simple spray can bypass that entirely. You've learned how to loosen tight fascia with just a spoon, how to stretch key muscles, glutes, hamstrings, inner thighs, in ways that relieve pressure and retrain your nervous system. And best of all, you've learned that you're not powerless. So tonight, try just one of these techniques, whether it's spraying your feet, doing a gentle knee pump, or simply shifting your hydration routine. Take action. Because every night without pain is a step toward freedom. Every morning without fear is a gift, and you deserve both. If this video helped, please share it with someone you care about. Someone else who's lying awake at night, wondering if they're the only one. They're not. And now, neither are you. Subscribe if you'd like more science-backed, senior-friendly strategies, and let me know in the comments, which tip are you trying first tonight? Your sleep doesn't have to be a battlefield. It can be peace. Tonight.